Your Excellency, the Right Honourable Patricia Scotland, Secretary General of the Commonwealth, Minister Huddleston, Honourable Ministers, Excellencies, dear colleagues and friends, good morning, good afternoon, good evening to you all. Allow me first of all to thank you for the invitation to come here today and contribute to this important meeting under the theme Creating an Inclusive and Resilient Sports Sector, Enhancing the Contribution of Sports to the SDGs. I share also warm greetings from my fellow Commonwealth Health Ministers. Excellencies, ladies and gentlemen, as I stand here today as a Health Minister, it would be an oversight on my side if I fail to acknowledge and recognize the immense contribution of sport in the improvement of health and well-being. It is of no doubt for many of us that sport brings fun and enjoyment into our lives. On the other hand, sport and physical activity also have tangible and proven health-related benefits. The evidence is telling us that physical activity has a profound impact on lowering the risk of non-communicable diseases, including cardiovascular disease, hypertension, diabetes, and breast and colon cancers. Sports therefore plays a vital role in making us a healthier, happier, and more resilient Commonwealth population. Excellencies, ladies and gentlemen, this powerful knowledge is important given the high and rising burden of non-communicable disease in the Commonwealth, which has been exacerbated during the COVID-19 pandemic. The burden is evident in every corner of the Commonwealth and is impacting on both rich and poor countries at all levels of society. We know that globally 1 in 4 adults and 4 in 5 adolescents do not get enough physical activity. The Commonwealth's small island developing states have the highest rates of diabetes and obesity in the world. This information tells us that more must be done to use sport and physical activity more effectively as an intervention to reduce the rates of NCDs that so greatly affect all Commonwealth citizens, both young and old. Jamaica is proud of how it has long recognized the power of sport across the health system, but also in the education system. For a very long time, we have had a mandatory physical education program from primary up to secondary schools. Innovative partnerships with the private sector have led to greater investment in school sport because of the value that is created by embedding a sport and physical activity habit for life from a young age. Despite this work, as a small island developing state, Jamaica has been hard hit with cardiovascular disease, cancers, diabetes, and chronic respiratory disease. This is why in 2016 we launched Jamaica Moves, recognizing the contribution of physical activity in reducing NCDs. Indeed, our work has been instrumental within the country and the Caribbean region. This led to the Commonwealth Ministers of Health in 2018 to adopt a similar model to benefit all Commonwealth countries called Commonwealth Moves, which advocated for using physical activity as a tool in addressing rising NCD across the Commonwealth. Building on these lessons learned and the potential of physical activity, sport, and Commonwealth moves to address the rising burden of NCDs, in May 2022, during the Commonwealth Health Ministers meeting, we welcome the Commonwealth Secretariat's new cross-sectorial project on NCDs, which is centered on addressing NCD risk factors through sports, physical activity, and healthy diets. This new Commonwealth strategic approach in the prevention of NCDs demonstrates the ability for multiple sectors to work together, not least sport, health, and education, in preventing the so-called sedentary death syndrome, of which the major actual cause of death is poor nutrition and physical inactivity. Colleagues, during last month's Commonwealth Heads of Government meeting, heads called for multi-sectorial coordinated action to reduce the incidence of NCDs and address the main risk factors, which include tobacco use, harmful use of alcohol, unhealthy diets, physical inactivity, and air pollution, including through enhancing the physical and mental health and well-being of citizens, while reducing population inequality in the prevalence of these risk factors. Excellencies, ladies and gentlemen, as we look towards the Commonwealth Games, I want us to reflect on how we can work together in a coordinated and collaborative manner to produce real public health benefits in these games and beyond. We must also acknowledge that through this approach of working together, we can adopt cost-effective intervention to empower our citizens to build resilience and physical activity societies. Most importantly, we must ensure that this is possible through further investments that ensure physical activity is safe, equitable, and attractive to our citizens, and that sports programs are sufficiently supported. These investments will allow sports and physical activity interventions to meaningfully contribute towards the SDGs, particularly as nations build back following the COVID-19 pandemic and its economic fallout. I am certain that together we can help our citizens to achieve stronger and healthier lives. For as we all know, good health is the best wealth. I thank you. Enjoy the games, and may God bless the Commonwealth.